Hello, everyone, and welcome to the third episode of trauma lecture series. Today, we are going to be talking about complex trauma, its protective factors, risk factors, and causes. Uh, Complex trauma. In our previous episode, I had explained what complex trauma is. It is a cataclysmic situation that affects many people, and it is often misdiagnosed as a post traumatic stress disorder or PTSD. While PTSD is the result of just one traumatic experience, complex trauma occurs when individuals go through repeated, multiple experiences of trauma. The word trauma brings up all sorts of vivid images, evoking powerful feelings, emotions, and reactions to traumatic experiences. As many factors affect an individual's responses, the impact of traumatic experiences are complicated. There is a combination of individual, relational, community, and societal factors which contribute to the risk of maltreatment. The result in loss of productivity, increases suicidality, violent behavior, and psychological disorder. The occurrence of trauma in an individual depends on a complex and intricate interaction between risk factors, which increases the effect of trauma, and protective factors, which reduces or eliminates it. Risk factors are those characteristics that are linked with abuse and neglect, but they could or could not be the direct causes of trauma, complex trauma. Some of these risk factors are disability or neurological disorders that may increase caregiver negligence, absence of familial solidarity, social deprivation or lack of community in families, drug dependency or mental health issues like depression in family, history of domestic violence, inadequate or feeble relationship and negative interactions between parents and children, family stress like separation and violence, including intimate partner abuse, inadequate understanding of children's needs or inadequate parenting, family situations or circumstances like low income parents, young age, um, low education, or single parenthood, parental mindset, thoughts, and emotions that justify or support abusive behavior, neighborhood disadvantages like poverty, higher unemployment rates, or poor social connections. Protective factors, on the other hand, are internal and external resources which reduce the impacts of difficult and frightening experiences for individuals. That sometimes make the difference between something being hard or something being traumatic. These are not completely foolproof factors which may help in reducing the severity of trauma, but are actually something that can shape or influence a situation or experience for an individual. These factors help in increasing a sense of safety, agency, and even hope. And they can be anything from a routine to a ritual to a creative outlet. There are a number of protective factors which have been identified for individuals experiencing trauma. However, it is important to understand which factors help individuals overcome trauma. Some of these protective factors are having a good problem solving skills and being resourceful, family environment that is supportive and friendly, being able to connect with others like family and friends, being able to locate positive meaning in trauma, having a good and strong supportive system that is available whenever the individual is in need, having faith in yourself that there is something you can do to manage your feelings, stability in family employment, parents or caregivers who display suitable and healthy affection, building a protective outlet like reading, baking, or arts and craft, having and taking care of a pet. Um, Being part of a protected community which is free of violence, oppression, pollution, and poverty can make individuals feel safe and guarded. When the home and the community an individual lives in feels safe, it automatically makes them feel seen and valued, and a sense of resilience is built. Connecting with these factors can be grounding for them. However, the question, what causes complex trauma, arises. Trauma can come in any form. It could be a soldier returning from war zone, or individuals, children, living with physical, mental, or emotional abuse or neglect, or adults experiencing domestic violence. Going through trauma can make an individual experience fierce feelings of guilt, which can make a person feel isolated and hopeless, and that they are losing control or not in charge of themselves anymore. Causes of complex trauma. Trying to look at the causes of complex trauma may feel asserting but can also be triggering. One might notice some physical activation like sweating or racing heart or dizziness, which is the body's way of indicating that a situation or an incident is making you feel overwhelmed. It can be triggered while simply reading something that you resonate with, which is completely normal. Some of the common causes for complex trauma are exposure to a capitalistic, patriarchal, and imperialistic environment, absence of safety, feelings of not being heard or acknowledged, witnessing or undergoing domestic violence, be it sexual, physical, emotional, or mental abuse, um, feeling helpless due to the lack of proper support, being pressured into conforming according to the society's notion of heteronormativity, being exposed to poverty, colonization, or genocide, being abandoned or neglected by parents or caregivers, being a victim to intergenerational trauma, living in close proximity to a war zone or a natural disaster, having an absentee parent or parents struggling from a drug or alcohol addiction. Since the causes of complex trauma are complicated and deeply intertwined with the moral code and structures of the society that we live in, like classism, sexism, transphobia, fat phobia, homophobia, and ableism, they usually intersect with those who are living with complex trauma. The societal oppressive system create inequalities which make it difficult for the people to gain access to resources. That in turn puts them at risk of experiencing violence and discrimination. Living in a system or society where one feels violated or as their identity or sexuality is not represented can be very traumatic. Although the experiences with trauma is different for every person, the recovery process is somewhat similar. Looking for support groups or or going to therapists or therapy or getting help from medical providers is okay. Hence, individuals recovering from traumatic experiences should be encouraged to seek help and find a recovery process that is manageable, therapeutic, and effective for them. It is never too late to find help to get one through trauma. It is the ability and the willpower of an individual that makes recovery possible. Thank you for watching, and I hope to see you next time.